So good evening, everyone. Thank you for joining to yet another interesting discussion as well as information on Breast Cancer Awareness Month. Today we are here to talk about the topic of body image after breast cancer, and we have with us a phenomenal panel as well. Quick intro on Patients Engage. We are an online platform operational for 5 years. We're focused on holistic and evidence-based management of chronic conditions, largely from the perspective of patients and family caregivers. We strongly believe in the value of lived experiences, and that's why we are here with a panel of patients and survivors, and how being empowered and being engaged and better informed leads to a better quality of life and overall well-being. I think a lot of you already know that we've been doing webinars for a long time. This month we are focused on breast cancer because of the fact that it's Breast Cancer Awareness Month. We have been covering a wide set of topics on cancer for the last few months. Just last week, we talked about staying fit after breast cancer, where we had somebody who started, Asha, who started running marathons at the age of 61, Shilpa, who lifts 70 kgs after bilateral mastectomy, and Pragna, who does yoga, runs, etc. So we had an interesting session. You can find that on our YouTube channel. The recording is up there. So today's panelists, and let me not take too much time, we have Rucha Ambe with us. Some of you have seen her in the conversation we had of talking to your children about cancer. She will talk about her journey and how it's impacted her. Vibha Rani, she is also a breast cancer survivor. Dr. Geeta from Max Healthcare is a breast cancer surgeon and very passionate about information to patients. She's also the co-founder of Bliss Foundation, which we have partnered with. We also have with us Urvi, Sabnis, who people who've been following our cancer webinars have seen for a while. She's been our moderator, but today we've also got her to be a panelist. And our team of moderators is Sheetal and myself, Aparna. And our partners today are Karuna Care Foundation from Ahmedabad, which is run by and started by Usha Kansha. Mr. Usha Kansha is a CML survivor. And Bliss Foundation, which is started by Nidhi Agarwal, who is a breast cancer survivor. And the co-founder, as I said, is Dr. Geeta, and the president is Reva Kumar. So let me, couple of guidelines. The information here is based largely on the experience of the panelists and does not replace your medical consultation. This session is being recorded, and if you're logged into Zoom, you can post your questions in the Q&A. If you have any other comments, you can use the chat function. If you are on Facebook, you can post your comments, questions on the live feed. We will be taking questions from the Facebook feed as well. And if you're a patient, survivor, or caregiver of cancer, please do join our Cancer Power Circle Facebook group, or if you have an experience to share, write into us at editor@patientsengage.com. And you can find all the recordings of the webinars we've done on our YouTube page. You can also join and subscribe to our newsletters and the various social media. So I will stop the sharing and get started because we have a lot of interesting insights that we are going to get today. So Dr. Geeta, if you can very quickly in kind of a couple of lines each, explain the various surgical options that people have. The reason I want to do that is because, the patients are going to be talking about each of their options, and we just want everybody to be on the same page. So, things like what is lumpectomy, what is mastectomy, what is reconstruction. So
the various options, thank you for having me on this panel. And the various options that are available to patients are a breast conservation surgery, but then you have to choose your patients. Not everybody is eligible for breast conservation. The second group is where you do a mastectomy, and the third option would be a mastectomy with reconstruction in the same sitting. So broadly, these are the three options. So when you say breast conservation, what you essentially mean is you're trying to save the breast. You remove the lump with healthy margins all around it. Whereas in a mastectomy, obviously, it is sacrificing the whole breast. And when I say reconstruction, it essentially means that you remove the breast, but you replace it either with a mound of tissue from your own body, which is called autologous reconstruction,
Mm.
or you could use muscle covering an implant to restore shape to that breast that you've lost. So these are broadly the three options.
Thank you, Dr. Geeta. Rucha, let's start with you. If you can quickly talk about your journey. So, the first time you were diagnosed with breast cancer, what were the options available, and what did you choose, and why?
Sure, of course. So the first time I was diagnosed, it was
Can you speak up
end.
a little? Sorry, it's a bit faint.
Um, is this better?
Yeah.
Cool. So the first time I was diagnosed, it was in end 2017, and it was a 5 centimeter tumor at stage 3. It had spread to my lymph nodes, and there were a few spots around it. But my surgeon was fairly confident, and given my age, I chose to do a breast conservation at that point in time. With the healthy margins, they had to remove an almost 8 centimeter diameter sphere
Mm.
out of the breast. And while I am well endowed, it uh, it was fairly a large chunk. So, along with a lumpectomy, they gave me an LD flap, which means they took tissue from my back, stretched it around to my breast, and stitched it together. So it looked like a breast, except for that one circle which had the flap in it, and I had stitches on my back. So the first time around, I went for lumpectomy, primarily because at 33 you're fairly concerned with how you look, appear. I had a job, so I didn't want to be answering questions every time I walked into a room. uh, the next year, almost within 9 months of completing my treatment the first time, I got re-diagnosed.
Mm.
Now, thankfully, that was at fairly early stage DCIS, which typically we call stage 0 cancer. But given my history and the fact that it's appeared within 9 months, the doctors this time said that let's do a mastectomy. Now, with mastectomy, I was given the two options that Dr. Geeta told us, that I could completely remove it, or I could remove it and do a reconstruction in the same cycle. The
Mm.
third option that I had was to cut off both the breasts at the same time, or to get the surgery, like if I choose reconstruction, then get surgery done on the second breast also, the unaffected breast also, so that both are of the same shape and size.
Right.
um Again, so okay, there were two things to there were two reasons why I chose the path that I chose. A, again, I didn't think could I had it in me to face the world without a breast. So I chose reconstruction. I chose not to touch my unaffected breast purely because I was still 34. I had hopes of having a second child, and I really wanted to, give it back to cancer by trying to breastfeed my child after being a breast survivor. So I asked them not to touch my second breast.
Right.
Uh, so that is what I chose. So I chose a mastectomy with reconstruction. They took muscle from my stomach. I had loads of extra to give, and then they reconstructed it. Now, unfortunately, what happened was, so when you, and Dr. Geeta can give more medical advice related to this, is what happens is when they take tissue from one part of your body and attach it, they also need to reattach the blood vessels. Now, all those blood vessels do not necessarily get successfully reattached. So what happens is some part of the tissue, the reattached tissue, may not get blood supply and it dies in the body.
Mm.
10-15% cases around that, I believe, is where it happens. I was among them. I've been drawing the short straw and number games for the last 3 years. And because of that, I lost 20% of my reconstructed breast. So while
Right.
I did choose mastectomy with reconstruction, I also fall in the category of people who have taken full mastectomy, in the sense that I have really, really unequal breasts that are visible to the world.
Mm.
So in short, I qualify for all three of those cases.
Right. So, so tell us a little bit about how did your view of yourself change at each stage, and
So
how did it affect you?
the first stage wasn't bad. I still had a breast which was roughly similar. I had a nipple. The only sensation I had lost was in that particular area where they had cut it open.
Mm.
The back scar, however, was the one that caused me a lot of consciousness. So historically, I have been somebody who's been pear shaped. So I the lumpectomy. I had a hole that needed to be filled in because tissue was taken out from it, and the hole was in big enough that you could put your fist in it.
Mm.
Before that could heal, the scar split open. So there's a lot of scar tissue and a lot of signs on my back, and it stretches right up to my spinal cord. So every after that surgery, I used to feel really conscious when I used to wear low back swimsuits or blouses or anything.
Mm.
um but that was about the only thing. My biggest change or difficulty in acceptance came with the mastectomy,
Mm.
because all I have right now is a lump of flesh where my breast used to be. There is no feeling. You can cut it open and I probably won't feel a thing. um there's no nipple. It feels different, it looks different, and it's right there every day, every hour when I look down. Because I lost so much of the reconstructed material. um, the shape is very, very different, and that meant I'm still trying to reinvent what may look good on me, because
Mm.
your clothes style is something that you reinvent over the last lots of years, right? You learn to see what looks good on you, what doesn't. You experiment. And this surgery kind of changes everything in a second, in those couple of hours. And you wake up with stuff that you thought looked good on you and now looks horrendous, horrible, draws attention to all the wrong parts of your body that you don't want highlighted.
Mm.
And that causes like this mental pressure. So that is something that has affected me. So it's affected me physically is a very small part. I think after what most survivors, warriors go through, the physical bit is the smallest part. It's more psychological. Of course, there are issues with intimacy that creep up because of this. There are issues with self worth that creep up because of this. Because good or bad, we've been trained to, be proud of a few things: hair, well endowedness, good figure, and like a snap, it's gone. And while, yes, I agree, everybody says you should be grateful that you're with us and you're living, and it's a small price to pay for your life. I am still struggling with the question as to why do we have to pay the price in the first place.
Right.
So it's affected at a lot of different levels.
Yeah. Thank you, Rucha, for sharing. In terms of, okay, we'll come back to that later. Let's move to you, Vibha. आप बताइए कि आप अपना थोड़ा वो डायग्नोसिस का भी बताइए, क्योंकि आपके केस में थोड़ा टाइम लगा था आपको ना, तो आप थोड़ा वो भी बताइए उसके बारे में.
हाँ, मेरा डायग्नोसिस,
Sorry, just introducing Vibha. Vibha is a folk artist, a writer and a theatre performer as well. So, yeah. So go ahead, Vibha.
Thank you, Aparna, and patient engaged, and everyone who are present here as a panelist and as an audience, invitees. मेरा कैंसर diagnosis, it happened in 2000.
Hindi में बात कीजिए Vibha, because we have a mix of audience, so we'd like to get
Yeah,
some.
no problem. I don't have any problem.
I know.
So in 2013 it was diagnosed. लेकिन उसके पहले पिछले 3-4 सालों से सडनली मैं हमेशा उसकी मैंने अपनी पोइट्री में भी उसका वर्णन किया है कि हाउ कैंसर लंप और ग्लैंड इट लुक्स लाइक. सो हम कहते हैं कि जैसे चने की दाल, अगर आप लोगों ने चने की दाल देखी होगी, मस्ट भी सारी औरतें ने नहीं देखी हो तो फिर बात ही क्या है. तो चने की दाल के बराबर का एक लंप जो है वो मेरे लेफ्ट ब्रेस्ट में वो यहाँ पर वो आया. और मैं उसको, चूंकि वो थोड़ी सी मैं बहुत ज्यादा पढ़ती थी, तो ये पढ़ा था कि सेल्फ चेकअप होना चाहिए. अब सेल्फ चेकअप कैसे होना चाहिए, मेडिकली हाउ टू चेक, ये मुझे नहीं मालूम था. लेकिन उसमें जो पढ़ करके और उसमें वो जो डायग्राम्स मैगजीन्स वगैरह में होते थे कि हाँ ऐसे करना चाहिए, ऐसे करना चाहिए, तो करके मैं अपने हिसाब से करती थी, किसी को कहती नहीं. और मैं वो ऑब्जर्व कर रही थी कि उसका साइज थोड़ा थोड़ा धीरे धीरे बड़ा हो रहा है. एंड इन द मीन टाइम ये बढ़ रहा है, एक लंप है. और इन द मीन टाइम उसके पहले 1991 में एक लंप आया था मेरे राइट ब्रेस्ट में, और इट वाज वेरी पेनफुल, वेरी हाईली पेनफुल, कि अगर मेरी उंगली, हल्की उंगली भी ऐसे टच हो जाए तो लगे जैसे कि जान निकल जाएगी. Immediately, doctor was consulted and doctor suggested for operation, and it was removed. It was sent for the test also, investigation also, और वो benign था. तो ये हो गया. ये इसमें कि ये लंप निकला हुआ है, बढ़ रहा है, इसमें कोई पेन भी नहीं है. और आमतौर पर हम यही पढ़ते थे कि कैंसर के जो गांठ होती हैं उसमें दर्द नहीं होता है. तो हमें लगता था कि दिमाग में एक घुसा हुआ था कीड़ा कि कहीं ये कैंसर तो नहीं है, कहीं ये तो नहीं है, कहीं नहीं. फाइनली हमने और जो मैं हमेशा कहती हूँ कि हम औरतें पढ़ी लिखी होने के बाद भी बहुत बेवकूफ होते हैं, और मैं भी उस बेवकूफ में अपने आप को शामिल करती हूँ कि ऑलवेज द मैटर ऑफ, सिंस इज अ मैटर ऑफ ब्रेस्ट, आई जस्ट रैन टू सम गायनेकोलॉजिस्ट. Not only Mumbai, my own gynecologist. Then in the recent then I shifted to Chennai. तो चेन्नई में भी वहां पर अपोलो और ये सब कांटेक्ट किया. उन्होंने ढेर सारे प्लान बता दिए, ढेर सारे प्लान में एंगेज कर लिया, पैसे लग गए. बट यही कहा गया हमें फाइनली कि आफ्टर 40 बहुत सारे, पूरे औरतों के बदन में बहुत सारे ग्लैंड्स निकलते रहते हैं, गांठ निकलते रहते हैं. इसको कितना कहते, क्या क्या देखेंगे, नथिंग लाइक दैट. तो जब एक फ्रॉम द माउथ ऑफ डॉक्टर अगर कुछ आता है तो आप निश्चिंत हो जाते हैं. मैं भी निश्चिंत हो जाते थे. लेकिन ये एक कंसर्न बना रहता था कहीं भी बैक ऑफ माइंड में कि ये क्यों बढ़ रहा है, अगर कुछ नहीं है तो ये बढ़ क्यों रहा है. फाइनली 2013 में अक्टूबर में मैं यहाँ बॉम्बे में कोकिलाबेन अंबानी हॉस्पिटल, धीरूभाई अंबानी हॉस्पिटल में वहां गई मैं किसी और दूसरी चीजों के लिए गई थी. सडनली मुझे याद आया और अगेन आई रश टू द गायनेकोलॉजिस्ट. थैंक गॉड कि उस दिन वहां पे गायनेकोलॉजिस्ट नहीं थी, और उनकी जो वहां काउंटर पर जो बैठी हुई थी नर्स सिस्टर, उसने मुझे पूछा कि आपको किनसे मिलना. मुझे इनफैक्ट पता भी नहीं था कि किससे मिलना है, क्योंकि मुझे इससे गायनी से रिलेटेड कोई प्रॉब्लम टचवुड नहीं था. तो मैंने उनसे ही पूछा कि मेरी ये प्रॉब्लम है, मुझे किससे मिलना चाहिए. उन्होंने कहा कि आप यहाँ क्यों आई हैं, डायरेक्टली यू गो टू ऑन्कोलॉजिस्ट, वहां जाइए. उन्होंने नाम को बताया कि डॉक्टर मंदार नागकर्णी इज देयर एंड ही इज ब्रेस्ट कैंसर डॉक्टर एंड यू गो एंड कंसल्ट हिम. तो मैं फिर वहां से नीचे आई. फिर उस दिन का तो अपॉइंटमेंट नहीं, नेक्स्ट वीक का अपॉइंटमेंट मिला, और फिर नेक्स्ट वीक का अपॉइंटमेंट मैं गई. वहां पर भी इट वाज जस्ट एन स्टोरी कि उन्होंने मुझे देखा और कहा कि इट लुक्स लाइक फाइब्रॉइड एंड इफ इट इज अ फाइब्रॉइड यू कैन लिव योर फुल लाइफ विद दिस, नो नीड टू वरी. मैं उनको देखने लगी, उन्होंने कहा देन व्हाई इट इज ग्रोइंग. तो उन्होंने कहा अच्छा ठीक है, आप मेमोग्राफी, मेमोसोनोग्राफी एंड बायोप्सी वो सब करवा लीजिए, और फिर उसके बाद देखते हैं कि क्या है, कैसे है. Then I went and same day, luckily, as a walk-in patient, I was treated and I was examined all with the mammography, mammosonography, and ये biopsy. फिर रिपोर्ट लेकर के गए तो दैट टाइम इट डिक्लेयर कि यस दिस इज कैंसर। ही ऑल्सो अपना माथा ठोक रहे थे, करे कभी कभी गट फीलिंग भी बड़ी अजीब सी हो जाती है। एंड देन आफ्टर दैट जो प्रोसेस होता है कि सर्जरी, एंड इट वाज माय कंजर्वेटिव सर्जरी। सो conservative surgery, today I was just attending one of his webinar also, and he was telling कि जिसको conservative surgery जिसकी होती है उसके लिए radiation is a must. So chemo and the radiation, and still I am on medication.
ठीक है। आपको आप परफॉर्मर हैं, आपको आपकी मतलब कंजर्वेशन हुई है, बट फिर भी आपको कोई इम्पैक्ट आपके बॉडी इमेज पर, आपके बाल गए उसका कोई इम्पैक्ट, क्योंकि स्पेशली एज अ परफॉर्मर, राइट?
देखिए ये सारी चीजें मुझे पता थी और डॉक्टर ने भी बता दिया था। जैसे डॉक्टर ने मुझे रेफर किया कि नाउ यू गो टू फॉर केमोथेरेपी, यू गो टू केमो एक्सपर्ट। तो मैं उनके पास, उन्होंने तुरंत बता दिया कि इसके 3rd वीक से आपके बाल गिर जाएंगे। दैट इज द वेरी फर्स्ट थिंग। मैंने अपने आप को सारी चीजों के लिए मेंटली प्रिपेयर किया था, बिकॉज मैंने अपने आप को सबसे पहले मेंटली इसलिए प्रिपेयर किया कि बिफोर मी 3rd family members of my family has gone with the cancer. Long ago, my mama ji, he lost his life with cancer. Then 2013 I was diagnosed. 2012 my jithani, my sister-in-law, she lost her life with breast cancer. My elder brother, he lost his life with tongue cancer. So 3 people had lost their life. I was the 4th one. So family members were also डरे हुए थे कि क्या होगा नहीं होगा, and I was thinking कि either I should go in their path or I should come here, or I should set some example कि no, I am here. So my first and last and single priority was there to remain here, to give a challenge to cancer, and to give and to fight with this disease. और इसी के लिए बल्कि तो मैंने अपनी बॉडी में मेरे क्या हो रहा है क्या नहीं हो रहा है, मैंने इसके ऊपर कोई ध्यान नहीं दिया। नंबर 1 की जो बाल गिरे, तो बाल गिरे 2 दिन, पहले दिन जिस दिन बाल गिरे मैं बहुत रोई, क्योंकि बालों के साथ सबका इमोशनल अटैचमेंट होता है। तो मैं बहुत रोई और मुझे, मैं आईने में अपनी शक्ल देख के मैं एकदम अजीब सा लग रहा था। मैंने अपनी बेटी से कहा कि मैं बहुत खराब लगी, मैं बहुत भयानक लग रही, यही वर्ड मैंने इस्तेमाल किया था, मैं बहुत भयानक लग रही हूँ ना। तो मेरी बेटी ने कहा, तो उसी साल मैंने उसकी शादी की थी 2013 में जून में उसकी शादी की थी। उसने कहा कि नहीं, तुम अभी भी उतनी ही सुंदर। And this word gave me a lots of encouragement and lots of हिम्मत, ताकत। And then उसके बाद हमने कहा कि इससे क्या होने वाला है। Then जिसको भी कहते हैं ना कि कोरोना में everything is an opportunity, तो that I treated and considered as an opportunity that time। हमने कहा कि ऐसे तो टकले होने का मौका कभी नहीं मिलेगा, इतनी हिम्मत नहीं होगी कि बाल आप मुड़वा लो। तो चलो अभी जो है ना, नेचर ने एक इसी के बहाने दिया है, तो एंजॉय योर टकलानेस। तो मैंने अपने बाल ढके नहीं इनिशियली 2-3 दिन, क्योंकि यूं ऐसे हवा आए, तो हमने उसके लिए जो है कि एडजस्ट होने के लिए हमने 2-4 दिन कवर किया। उसके बाद मैंने कभी अपने बाल कवर नहीं किए, कभी कोई विग नहीं लगाया। मैं जैसी थी वैसे ही हॉस्पिटल भी जाती थी, घर में भी जो हमारे जितने हम प्रोग्राम, जैसे आपने कहा कि मैं परफॉर्मर हूँ, तो मैंने रूम थिएटर इनिशिएट किया था, एंड लॉट्स ऑफ पीपल, 60-70 पीपल, दे यूज्ड टू कम। मैं उनके साथ भी ऐसे ही रहती थी, मैंने कभी कोई कवर नहीं किया। तो मुझे ये लगता है कि लाइफ इज मोस्ट इम्पॉर्टेंट देन माई आउटर ब्यूटी। बाल चले गए हैं तो चले आएंगे। देखिए कैंसर में, केमो में तो हो जाता है। यू थिंक अबाउट द एलोपेशियंस, उनके तो बाल आते ही नहीं है, तो क्या वो अपनी जिंदगी छोड़ देंगे? नहीं, उनको अपनी जिंदगी नहीं छोड़नी है। और हमारे बाल, और ये तो होता है कि केमो के बाद तो और बड़े खूबसूरत बाल आते हैं। मेरे भी बड़े खूबसूरत बाल आए।
Rucha doesn't agree to that. She did not want the chemo curls.
Not at all.
I wanted curly hair. In fact, I chose my husband because of his curly hair. So and second thing, that my breast. For breast also, it is this is our society's patriarchal society, and we are governed by, we women, even we educated women also governed by this patriarchal thought. what I think, what I believe, my body is my body. Whether my breast is flat, whether my breast is curved, whether my breast is bulky, whether my breast is whatever, it is my breast. If it is gone, but my life is here, मेरी जिंदगी अगर यहाँ है, तो ब्रेस्ट के जाने ना जाने से कोई फर्क नहीं पड़ता. और जैसा कि अभी बात करनी थी और डॉक्टर गीता भी बताएंगी कि इतने सारे रिकंस्ट्रक्शन है. आप रिकंस्ट्रक्शन से ठीक है, थोड़ा सा जो है वो ऊपर नीचे हो जाएगा, तो लेकिन मेरा अपना मानना है, या पहले हम लोग अपनी दादी नानी चाची भाभी वगैरह से, वो लोग जो आपस में खुसुर फुसुर करती थी, वो खुसुर फुसुर में ये होता था, ये कहती थी कि दोनों ब्रेस्ट कभी भी एक समान साइज के नहीं होते हैं. ये उनकी आपस की जो है ना, जो चुटुर पुटुर होती थी, वो चुटुर पुटुर होती थी, जो हम लोग छुप छुप करके सुनते थे. तो इस छुप छुप करके सुनने में भी हमने ये सुना था कि दोनों ब्रेस्ट जो है, अपनी ही बॉडी के दोनों ब्रेस्ट हैं, वो साइज एक समान नहीं होते. जैसे आपके पैर के साइज एक समान नहीं होते, आपके जूते में फर्क आ जाता है, उसी तरीके से ब्रेस्ट के साइज में भी फर्क आ जाता है. बट ब्रेस्ट के साइज में व्हाई शुड आई फील सॉरी, जिसके लिए मैं रिस्पॉन्सिबल नहीं हूँ. कैंसर मैंने इन्वाइट थोड़े किया है कि आजा. वो आया, हमने ट्रीट किया, हमने अपने आप को पॉजिटिव रखा, एंड नाउ आई एम क्योर्ड. माई लाइफ, माई फैमिली, माई चिल्ड्रन, माई एंटायर वर्ल्ड इज विथ मी, और मुझे उसके साथ जीना है. तो मैंने अपने ब्रेस्ट को लेकर, वैसे भी मैं बता दूं कि मैं हमेशा मजाक में कहती हूँ कि माई ब्रेस्ट इज रोलर ब्रेस्ट. तो बचपन से इस सब सारी चीजों को हमने बहुत झेला है कि अरे इसके तो ब्रेस्ट ही नहीं है, तो इसके तो ये है, तो ये तो छक्का जैसा लगती है, तो इसका तो ऐसे होगा, तो ये बच्चा होगा तो ये दूध कैसे पिलाएगी, तो फलाना कैसा, ये तमाम चीजें. और फ्लैट ब्रेस्ट या स्मॉल साइज ब्रेस्ट कोई मेरे ही नहीं है. अगर आप पूरी दुनिया में देखेंगे तो लाखों लाख लड़कियां और महिलाएं हैं जिनके ब्रेस्ट साइज छोटे हैं. तो लेकिन ऐसा नहीं है कि वो इंसान नहीं है, या उनके अंदर लाइफ नहीं है, या उनके अंदर इमोशंस नहीं है. ये हमने अपनी पैट्रियार्कल सोच से बता दिया कि उन्होंने कहा है कि हमारे ब्रेस्ट जो है वो बल्कि होने चाहिए, बिल्कुल एकदम कालिदास की नायिका की तरह होनी चाहिए, हाँ, यक्षिणी की तरह होने चाहिए. ये हमने बनाया है. वो यक्षिणी की मूर्ति बनाने वाला भी कोई है, वाली कोई नहीं है. तो उसने बनाया है और हम उसकी कल्पना में, तो हमें उसको बिल्कुल हटा देना चाहिए. मैंने तो उसको हटा दिया था. और आज भी मैं बीइंग ए परफॉर्मर, मैं जैसे हूँ वैसे ही जाती हूँ. हाँ, मैं पैडेड ब्रा पहनती हूँ, शुरू से पहनती थी और अभी भी वही पहनती हूँ, वैसे ही पहनती हूँ. कोई स्पेशल अपने आप को और कर्व्ड करने के लिए कोई बहुत स्पेशल तरीके से मैं ब्रा नहीं पहनती हूँ. और जो जैसे आप मुझे अभी जैसे देख रहे हैं, मैं परफॉर्म करने के समय भी वैसे ही जाती हूँ. और मेरा ये मानना है कि लोग मेरा परफॉर्मेंस देखने आ रहे हैं, मेरे ब्रेस्ट देखने नहीं आ रहे हैं. और अगर मैं बहुत खराब परफॉर्मेंस करूंगी और केवल ब्रेस्ट हिलाती रहूंगी, तो वो कहेंगे कि ये ब्रेस्ट हिलाने आई है कि परफॉर्म करने आई है. तो वो performance is most important than showing my breast.
Thank you, Vibha. Dr. Geeta, one question which comes up sometimes is for women, depending on the breast size, is self breast exam different, or is it more difficult to, I guess, detect cancers in one or the other?
See, it's basically size versus your commitment to checking yourself very carefully. If you've got a bigger breast, it automatically your ability to go over the entire breast with the same commitment really goes down. And if it is very big, then the hidden areas of the breast will remain hidden to your hand also, especially the lower half of the breast. वहां पे हाथ का जाना काफी मुश्किल होता है. और अक्सर अभी रिसेंटली मैंने एक पेशेंट को देखा है, छोटा से लम्प से शुरू हुई थी, बट इट इज बिकम एन अल्सरेटेड लीजन. अब वो अल्सर बन गया है. क्योंकि हाथ जाता ही नहीं है वहां पे. आप देखना, हमेशा ब्रेस्ट के निचले हिस्से वाले जो ब्रेस्ट कैंसर्स होते हैं वो अधिकतर एडवांस भी होते हैं. इसीलिए भी होते हैं क्योंकि जहाँ पे वो क्रीज बनता है वहां पे टिश्यू बहुत ज्यादा नहीं होता. तो जो कैंसर बनता है वहां पे उसके पास कोई रास्ता नहीं रहता, बल्कि वो स्किन की तरफ ही निकल के आता है और नीचे चेस्ट वॉल की तरफ भी जाता है. तो ये आपके कमिटमेंट पर है. पर मैं जरूर मानूंगी कि अगर ब्रेस्ट बड़े हों तो आपको उस पर हाथ फेर कर उतने ही कमिटमेंट से देखना मुश्किल होता है. छोटे ब्रेस्ट का ये एडवांटेज जरूर है. तो जितने भी डिसएडवांटेजेस लोग गिनवाए,
आपने देखी
ना, आपने जल्दी पकड़ा ना, आपने जल्दी पकड़ा क्योंकि छोटा ब्रेस्ट होने की वजह से आपको बहुत समय नहीं लगाना पड़ता उसको ढूंढने के लिए. Big breast is a problem. Breast self-examination is a problem in big breasts.
Thank you, Dr. Geeta. Urvi, coming to you, as you know, because you're both a survivor as well as a counselor, but first as a survivor, can you talk to us about? I think you talked the other day about an experience about uh, uh, the scars, right? So if you can share that experience, then that will be useful for our audience.
Yeah. So I had undergone reconstruction of my left breast, and it was tram flap surgery, which is like cut is from hip bone to hip bone. The entire lower abdomen was cut, and my skin couldn't take those soluble sutures. So every now and then I used to bleed from there after the surgery. So I had to rush to the hospital again and again to get it, fixed. And every time my plastic surgeon would say that, give it 2 days and we'll do something about it. And every couple of days I used to hear the same dialogue, we'll do something about it, we'll do something about it. So, and we were really not tired, but we were actually very concerned and worried that what is happening to me. Like, so once we decided that today I'm going to ask him that what is it that you want to do and you are delayed. So on the examination table, I asked him that what is it that you are delaying. So he just looked into my eyes and he said that if I resuture it, the scars would remain for life. And the soluble scars, they dissolve, and in a couple of months you will be like completely normal looking skin you will have. So I said, so what? So he said that generally husbands don't like having scars on a wife's body. So I didn't tell him anything, and I got out of the room and I told my husband that this is what doctor said. And immediately he rushed to the doctor and said that get the thing done, get her out of this pain. And after we left the hospital and we sat in the car, my husband said that we'll see it as a flag of our victory. We'll never see it as a scar. So that made me like super confident with all my scars. And after that, like I wear all my scars with super pride. So that I was sharing with you. Yeah.
Yeah.
दाग अच्छे हैं.
Yeah. So, I think it's important because I think, again, scars are something that bother a lot of people. So, again, um, Rucha, do you have anything to add or anything that you'd like to share on that
Yeah,
or on the hair?
on the hair bit I'll come, but I would just like to add on to whatever Vibhaji said कि uh, जान ज़्यादा प्यारी होती है breast के सिवा. So as part of my awareness thing, I like to reach out to people and tell them कि भाई कोई सवाल हो, if you have any questions, if you have any doubts, if you suspect anything, just reach out to me and I will try and take you through the entire process. Because if it can happen to me, I had no history, nothing, then it can happen to anyone and you should be prepared for it. Like I had detected my lump in what, August, and it took me till December to get it checked because it never struck me that it could be cancer. But okay, so coming back, my belief there is it's completely on the person. जिसको जो चाहिए वो choose करे. So as part of my counseling sessions, I spoke to this girl whose mother was diagnosed with breast cancer, and she was of the opinion that she's 60, we are telling her to get rid of the breast, kya karengi, it's okay, at least she will be there with us. And to that, my question to her was, are you going to be the one waking up without breasts in the morning? Are you the one who's going to have a look at it in the mirror every day? No. If not, then you don't have a say in it. Like Vibhaji rightly said, my body, my breasts, I get to choose. But I have seen this happen in cases where the family is pressurizing, saying, निकाल लो ना, क्यों रखना है अपने अंदर? Shouldn't keep it. It's just a body part. It's an extra body part. Yes, but it's my body part. I care for it. I have emotions attached to it. Um, it matters to me because I'm going to live with it. Nobody else is. Nobody else is going to walk into a room like that. Nobody else is going to have people, you know, look at them again saying, Acha, something looks different. Um, so I have to deal with all of that on a daily basis. So if you choose the way Vibhaji did, the way Urvi ji did, the way I did, perfect. But please don't pressurize anybody nearer to you to either remove it all or not remove it because you want this, um,
So
or you
it's their
don't want
choice.
stuff.
Leave the
It's
choice to the
absolutely,
right.
absolutely,
Right.
absolutely.
So, Dr. Geeta, on that, again, as a surgeon, I'm sure you come across these situations as well, right? What is your recommendation to the patients and their families? What should they, uh, what should they consider while making this decision? And first of all, how do you, encourage the patient to make the decision and not let the family members make the decision?
Look at our country, even today, about 80% of your breast cancer surgeries are just mastectomy.
Mm,
Straight shot, just mastectomy. There
correct.
are various reasons to it. So if, you could have a 1 centimeter lump and you would have the patient undergoing a mastectomy for various reasons. One of the reasons, of course, if it is a scientific thing, like I think Rucha said, or is it Vibhaji said? Vibhaji said that if you do a conservation surgery, radiation is mandatory. So if in the place that you live in or the hospital that you've gone to, whichever, the logistics don't work out and you don't have a radiation facility, my advice would be don't go for a breast conservation.
Right.
Okay, so that is clear. And in our country, she talked a lot about the patriarchal nature of our society, which is very, very true. So anybody could be making the decision for you. So I see these young girls who are late 30s or early 40s, and the padosi is making the decision. Are don't keep the breast, it'll come back. But there is no
Mm,
scientific basis to it. So
right.
I think I strongly support Rucha in saying that, you make that decision. I mean, who are you to decide what works well for me and what doesn't work well for me? And if I am
Correct.
amenable to conservation, why not? It's about, and I can assure you, it's not just about these young girls. The oldest that I have done a breast conservation is an 80-year-old.
Mm,
She wants to keep her breast. I'm nobody to tell her, look, this is the option. You're old now. You don't need to keep. What is the use of the breast? So there are people who discuss it like that.
right.
You don't need to
Correct.
discuss it like that. You will tell her exactly what exists and why should she lead a lesser life just because I think that is right for her, because what I think is right is not right for her.
It's not right.
So
Correct.
I think we need to discuss this broadly, help them make that decision. And sometimes, in a younger woman, I would do an MRI and I'll tell her, look, I want to do a breast conservation for you clinically. And when I feel you, I think you are amenable to it. But in a young breast, you can miss smaller specks of cancer elsewhere.
Mm,
Let me do an MRI. And it is possible at the end of the MRI, I would be telling you that, look, you don't seem to be a good candidate for breast conservation.
mm,
But by the time I'm getting to that point of the conversation, the patient is already well adjusted to the fact that, yes, today it seems like breast conservation, but the MRI can change a few things.
right.
Although this argument out there in our scientific community, whether those lesions, extra lesions that you pick up on MRI is clinically significant or not. But at
Mm,
least in our country, I would not risk another abnormal lesion and leave it alone and say, look, I'm going ahead with it. There
right.
are many, many centers who don't do an MRI, but in a young patient, I would definitely do an MRI and base my decision on that.
Okay. Thanks.
Dr.
Uh,
Geeta had one question.
sure. Yeah.
Yes,
Many people state that the mastectomy itself causes more trauma than the cancer, as a disease. So, what kind of psychotherapeutic kind of options can we give the patient? Do we have like counselors speak to them before? You as a surgeon, are you taking that? Do most surgeons take the time out to kind of educate the patients and speak to them about all the kind of body image issues that they may face later on?
So now, this has come to occupy center stage. So, my counseling or my conversation with the patient was different about 7 or 8 years back. Things have changed. You keep evolving as times go by, and you really see that there are patients who earlier used to be docs of aap jaisa bolenge वैसा करेंगे. This is a very common thing in our country, but now things are changing because you have very empowered women coming to you and saying, give me the best. You've got to help me make that decision. So my responsibility has changed over time. And like you said, there is a psycho-oncologist involved. All centers do not have the facility of a psycho-oncologist, but fortunately in our setting, we do have a psycho-oncologist who can take you through all this. So recently I had a patient who's 42 years, had locally advanced breast cancer on one side. And just 2 weeks ago, I had operated on her and she came back and said, look, I want my other breast off. I said, wait, just hold on, because why should you get the other breast off? She said, I don't want to live in this fear of getting a breast cancer on the opposite side. I said, but that's not what is going to define outcomes for you. What is going to define outcomes is the breast, which is already affected with a locally advanced breast cancer and not the contralateral breast. But she just won't hear of it. And we do get these situations every other time that the patient asking for a contralateral breast removal. It's happening very, very commonly in the United States of America also. So if the breast conservation rates were close to 70%, it's come down to a 50% because 50% of patients are undergoing mastectomies and contralateral mastectomies, prophylactic meaning you don't have disease and you're undergoing surgery. So this thought is catching up because what happens is patients also pick up bits and pieces of information and just work out what is good for them. But that may not be the right thing. So I told her, I am going to put you through the psychologist. We're going to have a special tumor board where we will discuss your case because I don't see a good enough reason to sacrifice the normal breast. So we put her to the tumor board and then the tumor board has to give us an endorsement. Okay, if she's so convinced, we're going ahead with it. Then I put her through the psychologist and the psychologist came back and said, oh gosh, she said, I learned a few things from this, courageous woman because she is absolutely, absolutely certain in her mind that she doesn't want the second breast. And she can be your ambassador for, courage stories. And because we do run a support group and we always look forward to such women who can add value to the lives of women who cannot make a lot of decisions. But she decided, and so we went ahead with this surgery. Right and wrong, I do not know still. But she says, I've made the decision, I've made peace with it, and I don't want to hear anything else about it. So that's fine. That's her life.
Correct.
Yeah. And for Rucha's viewpoint is absolutely, and the world is divided. You'll have 50% of women thinking like you do, and there could be 50% of women who say, look, I don't care about my scars. The scars are beautiful, and you will find a lot of people actually tattooing the scars, doing wonderful things with their scars. So all that is absolutely fine. When I was in the UK, it's quite paradoxical. You could have a 5 centimeter difference between the two breasts, and the woman would not be complaining, but there could be a 5 millimeter difference, and she could be complaining, "Oh, doesn't look right. It just doesn't look right." So it's all perception. It's very, very individual. It's a very personal thing. But I think our job is more to guide you into those decisions. And in surgery, like Urvi, things can go wrong. Things do go wrong. But I think the hand holding has to be more intense if things go wrong. I cannot let you go. If things have gone wrong, I have to say, well, these things do happen, but this is my responsibility to make sure they become better and you go back feeling right. That's my responsibility.
I think on that note, we are already over time. If there's any questions, any final questions from the audience, or I'll just check the Facebook if there is. I think there's a lot of comments which are saying, positive things. If anybody on Zoom wants to ask any final questions, this is your last chance. Okay, so somebody did ask, sorry, Dr. Geeta, and anybody else, please discuss about vaginal dryness and menopause related issues. So just to let the person know, we will do a little bit more in the next one, but if there's anybody who would quickly want to talk about that. Dr. Geeta, do you have, I know we talked a little bit about vaginal
I
dryness.
touched upon vaginal dryness. जिन लोगों का ट्रिपल नेगेटिव ब्रेस्ट कैंसर होता है वो तो फिर भी ईस्ट्रोजन क्रीम्स यूज कर सकते हैं फॉर vaginal dryness. But those who are hormone sensitive tumors, I would not advise you to use estrogen creams because they can be absorbed and we don't want any estrogen in our system. So उनके लिए तो नहीं है. So आप ब्लैंड जेलीज यूज कर सकते हैं, जैसे जो हम लोग ECG करने में जो जेलीज यूज करते हैं ना, KY जेली के नाम से, किसी भी नाम से होता है, वो यूज कर सकते हैं. दे आर ब्लैंड जेलीज, so that can be applied before your sexual activity. So that is something that you can do. And sometimes vaginal dryness can be quite difficult to deal with because it can give rise to repeated urinary tract infections and all that. I may not be able to tell you how to deal with that bit. There are doctors who are urogynecologists. They should be the best people to address this situation. The second bit about menopausal symptoms. I completely agree with you because, I also know that if there is somebody who can discover a cure for hot flushes, उसको Nobel Prize मिल जाएगा. Because I think hot flushes is something that women deal with it, especially those who've undergone chemotherapy because their ovaries go into shutdown mode. And so our estrogen hormone is a brilliant hormone. That's what gives you shape. जब फिगर की बातें करते हैं जवानी में, ये सब उसी की वजह से है. लेकिन जब उसको हटा दिया जाता है तो यू स्टार्ट गेनिंग वेट, आपके मूड स्विंग्स शुरू हो जाते हैं जो मेनोपॉज में होता है, आप डिप्रेस्ड हो जाते हैं, आपके बोन्स आपका तंग करने लगती है, आपको कार्डियक इश्यूज होने लगती हैं बिकॉज ईस्ट्रोजन हार्मोन इज फ्रेंडली टू ऑल दीज बिट्स. सो हमारा ट्रीटमेंट भी कुछ हद तक खराब होता है क्योंकि हम आपका ईस्ट्रोजन और चुराने में लगे होते हैं, क्योंकि हम कहते हैं कि नहीं बिल्कुल ईस्ट्रोजन नहीं छोड़ना इसके. तो menopausal symptoms can be quite difficult to deal with, but there are medications which help some, which don't help others at all. जैसे वेनलाफ्लेक्सिन है जो हम देते हैं पेशेंट्स को जिससे कि हॉट फ्लशेस थोड़ी कम हो जाए. कुछ और चीजें हैं which have been tried but there are no uniform results, like black cohosh is one of these herbal medications that can be had to reduce the intensity of hot flushes. But otherwise, there is no real convincing treatment for hot flushes, unfortunately. Some people have tried acupressure also for hot flushes, but it's all hit and try, but there is no definite method by which you can deal with it.
So we didn't speak so much about hair or looks, but what I've figured out is what makes a huge difference is how the people that we love, that we care about, that are around us, deal with our change in looks. So, for example, I lost my hair twice. First, when my daughter was 2.5 years old, and the second when she just turned 5, and I lost it a couple of months back. The first time around, both times, I was very comfortable with my baldness. So was my husband, so was everybody else. The first time, so was she. And I took a very conscious call of going bald because she should know that hair is not the only definition of beauty. And, there's nothing to be ashamed of, exactly like Vibha said. But the second time around, now that she's a little older and there's peer pressure and, she's getting into how do I look, how does everybody else look kind of comparisons, she has issues. She had issues with my baldness. I was asked not to speak to her friends, parents, or come on video calls, not become a part of a birthday video because everybody else would see me bald. And that affected me a lot more than my actual baldness. So if you're a caregiver to anybody who's undergoing any of this, don't stress on the difference. You may find it difficult. Trust me, they are finding it 100 times more difficult to accept it. So just be as accepting as you can, because your non-acceptance will cause a further reduction in their body image than what they're already struggling with.
Correct. Correct. No, I think that's a good point. Thank you again to both Bliss Foundation and Karuna Care for your support as well. Yeah, thanks Vibha for coming back. So thank you. Thank you all for sharing so honestly and candidly. I think it is really important that we, get these conversations out there and get people more comfortable about talking. So I think
I salute the courage of all these women who are here, Urvi, Rucha, and Vibhaji. So I think it takes a lot of courage to speak, but I think you are the people who are going to make a difference to the way women perceive themselves. It is so important to change. For a lot of people, those options don't exist. Just as Rucha was so vehemently saying that this is the way I want it, I wish there are more women like that who feel empowered to say that. They want to, but they just don't muster the courage to say that.
there may be many more than just these three or four, but our attempt always is to talk about the different narratives and ultimately let patients and families be informed and be empowered to make decisions.
I've been
And
really educated, I'm sure. I can assure you.
thank you so much.
Thank you.
So
Thank you,
thank you
everybody.
everyone.
Thank you.
Yeah.
Bye bye.
Thank you.
Bye. Bye.
Bye.